The split-brain experiments primarily stem from the work of neurosurgeon Roger Sperry in the 1960s and 1970s. These studies focused on patients who had undergone a corpus callosotomy, a surgical procedure that involves severing the corpus callosum, the bundle of nerve fibers connecting the two hemispheres of the brain. This operation was often performed to alleviate severe epilepsy. Key findings from split-brain experiments. 1. Hemispheric specialization. Left hemisphere, generally associated with language, analytical thinking, and logical reasoning. In most right-handed individuals, it controls speech and language processing. Right hemisphere, more involved in spatial abilities, face recognition, and processing nonverbal information. It is often associated with creativity and intuition. 2. Visual processing. Sperry's experiments involved presenting visual stimuli to one hemisphere at a time. For instance, when an image, like a dog, was shown to the left visual field, processed by the right hemisphere, patients could not verbally identify it. However, they could draw it or choose it from a selection of images, indicating that the right hemisphere recognized the object but could not communicate it verbally. 3. Motor control. When patients were asked to use their left hand, controlled by the right hemisphere to perform tasks, they often did so successfully, even if they could not articulate what they were doing. Conversely, the right hemisphere could not verbally explain actions initiated by the left hemisphere. 4. Cognitive competition. The severed corpus callosum means that the two hemispheres could sometimes exhibit conflicting behaviors or responses. For example, one hemisphere might perceive a stimulus and respond to it, while the other hemisphere might not have access to that information, leading to a lack of coordination or understanding between the two sides. 5. Emotional and personality differences. Some studies indicated that the right hemisphere might be more involved in emotional processing and the perception of emotions. This could lead to differences in personality traits, with some patients displaying more emotional or impulsive behaviors after the surgery. Theoretical implications. Dual consciousness. The split-brain research has led to discussions about the nature of consciousness and whether each hemisphere could be considered a separate consciousness with its own thoughts and experiences. Integration of information. The studies highlight the importance of the corpus callosum in integrating information between the two hemispheres, allowing for coherent thought and behavior. Conclusion. The split-brain experiments provided valuable insights into the functional specialization of the brain's hemispheres and how they interact. They revealed that while each hemisphere has distinct roles, they typically work together to form a unified experience. The findings are instrumental in understanding not only brain function but also broader questions about consciousness and identity.